Transition, in the sense that we're talking about it today, is the development of a young person's participation in their own healthcare. If you're a child and you develop a disorder, or you're born with something that means you're going to need medical treatment for a large part of your life, maybe all of your life, you'll probably have excellent care throughout your childhood. That care will be supported by a range of doctors and nurses who are experts in paediatric healthcare, whatever that may be. That may be urology, but it may also be other things like rheumatology or diabetes or asthma, to give some examples. We're talking about urology today, and that healthcare will be delivered in a children's centre with paediatric urologists and their specialist nurses around them. While you're having that care, that's often going to be supported by your parents, and lots of decisions, particularly when you're very young, may be made by your parents on your behalf. As you grow older, then your participation in that healthcare becomes much more important, because the decisions are about you and how you want to go on and look after yourself for the rest of your life. And transition is about facilitating that. It's about teaching somebody who's had care in childhood, who's going to need care in adulthood, to move away from decisions that are being made about them to making decisions for themselves. Preparation for transition is really important. There are lots of websites about it and lots of tools on the internet, but the fundamentals are really about trying to engage a young person in understanding their own diagnosis, understanding the treatment they've had, the types of problems that they need to look out for, and the types of treatments that they might need in the future. That involves a long-term discussion over a number of years and appointments where those conversations and that knowledge can develop. That's really the basis behind preparation for transition. And once a surgeon or the healthcare team are happy that there aren't any acute medical problems that they need to solve themselves, and once a patient and their parents are happy that they are autonomous enough in their own healthcare, then that will be the time when somebody is about ready to start thinking about being looked after by a team that's geared up to look after them in their adolescence and their adult life. So my role in transitional urology is really to look after children as they grow into adolescence and adulthood. I involve myself in doing that by going and meeting my paediatric urology colleagues at paediatric centres, seeing patients there, and then setting up their care when they move to the centre that I spend most of my time in, which is University College Hospital and the Princess Grace Hospitals, which is where we've set up a service that's designed to look initially after adolescents and then subsequently people as they move into their adult life. As part of that, we try to make sure that we understand the outcomes of both disease and its treatment, and we try and report that with our paediatric colleagues so that they understand what's happened as patients move into adulthood. We also talk about it at adult meetings because we'd like more people to become involved in looking after adolescents and adults who've got urological diagnoses that are important and that need long-term care. So there are lots of parts to my role: meeting older children and preparing them for transition, dealing with their transition and then looking after them into their adult life, but also trying to make sure that we all understand what the outcomes of that work in paediatric care has been. In terms of advice for patients and their parents who are going through transition, we as doctors need to understand that that's a really important time in your life. There's a lot that's changing for you, and we need to be mindful of that. It's difficult because you're growing and changing your own body, and then somebody is telling you that you are going to need to move from one doctor or one team that you've grown with and trusted to another team of doctors and nurses that you may never have met before. It's really important for you to try to understand that the team that have looked after you are doing their very best to make sure that you are looked after for the rest of your life. And they have formed a trusting relationship with the team that they're sending you to on the basis of understanding that working pattern and their ability to look after you. It doesn't mean it will feel any less difficult for you, but perhaps that will help you to understand that the teams work together to try and make sure that you are well looked after. There isn't an absolute age that's right for transition, and medical teams will make a judgment with you about when it's right for you to move from the team that's been looking after you to the team that's going to look after you in the future. In general, people will start thinking about transition in your early teenage years and perhaps preparing you for that as a step over the course of the next few years. Some paediatric hospitals are limited with an upper age at which they can see you. That may be 16 or 18, for example. So we try to take any specific limits out of it, allow you to be well prepared for it, and the teams then to make a decision that allow safe and sensible transition with you.